All three techniques, VNS, DBS, and RNS, have an FDA approval for management of a focal epilepsy, and depending upon the target, the deep brain stimulation, the electrodes are going in the brain. Depending upon the patient's type of epilepsy and the type of their seizures, we select the target, that which target will be ideal for that patient for DBS therapy. Similarly, for RNS, responsive nerve stimulated, RNS, responsive nerve stimulation therapy, is extremely important to understand the patient's epilepsy type and their epileptic focus, where the seizures are coming from in the brain. And based on that information, then we can make a judgment call where the electrodes have to go for RNS. VNS does not need much pre-investigation to determine what kind of epilepsy or where their epileptic focus. It's a little bit easy, straightforward surgery, and the generator goes on the chest, the wire is wrapped around the nerve. And if the patients are not doing well for focal epilepsy and are not interested in any further investigation for any reason, VNS can be a little bit more easy, straightforward, outpatient-based surgical intervention. Regarding FDA approval and insurance approval, among all three neuromodulation therapy, VNS, deep brain stimulation, DBS, and a responsive nerve stimulation, RNS, all three of them have an FDA approval for management of focal drug-resistant epilepsy. There are other epilepsy types where we do not have an FDA approval, but based on their epilepsy type, their seizure type, we do make a selection. And for generalized epilepsy, and we do work with insurance and with the surgery team to come up with a target and get the right therapy for the patient.